Hi guys, so I wanted to show you a chest x-ray first because I promised you today that I would show you some things that I have. So this is actually a chest x-ray that my son had done a few years ago, and so he was actually, this chest x-ray is a number of years old. I think it's probably 7 or 8 years old, but it happened to be the first disc I pulled out of the pile. So this is a chest x-ray, and it shows his anterior view, and then it shows his lateral views. And so I wanted to point out a couple of things. I am not a radiology person, but I do know to look for basic markers. So I will show you what those basic markers are. So if you're looking here, your bone absorbs radiation a little bit differently than tissues and air does. And so that's why bone turns white on x-ray film. So bone absorbs the most, which makes it white, and then tissue absorbs a medium amount, and that makes it gray. And so you can kind of see where his skin is here along the sides and then up over his arms here. And then you can see kind of the skin on his face up here underneath his chin. And then air is in his lungs, and so that is the black portion where his lungs are. So anywhere you can see black here is where there's air in his lungs, which is where it's supposed to be. Same thing on the lateral view. You can see the air in the lung there, and then on the right view also. So if we're going back, you can also look for other basic things. Like you want to make sure that the clavicles are even. So in this instance, his clavicles are even. They are where they're supposed to be, so that's good news. You can also look to make sure that the spinal column is directly posterior to the sternum. So if you look here, you can see that this is where his sternum would be. This is the front chest bone, and you can see actually through his sternum all of the different vertebrae back here. So you can see his cervical vertebrae up top here, and then down here you can start to see his thoracic vertebrae. A couple of other things to note. This margin here, this lump out here into the left lung, is actually the left ventricular margin. And I don't know if you remember me telling you guys a couple of weeks ago, but your left side of your heart is what pumps out all of the blood to the rest of your body, and so it's a little bit bigger. And because it's a little bit bigger, it reduces a little bit of the air capacity in that left lung, which is why it looks like you have more air in the right lung. You do, because the right margin of the ventricle, the right ventricle, over here doesn't take up as much room. So that would be the right ventricle here and the left ventricle over here. So that's actually his heart. And then if you look at this white area here and this margin here, that would actually be the diaphragm. So that's about all I know for x-rays, but I figured I would start with an easy one before doing the video for CT scans and echoes and MRIs. So there you go.